All right, your morning health watch. People have cravings all the time when it comes to food. Maybe you're craving something in particular right now. But how do you manage them or maybe tweak that craving urge to something a little more healthy? Well, that's why we have Dr. Gary Kaplan with us, founder and president of the Kaplan Center for Integrative Medicine and clinical associate professor at Georgetown. Good to see you this morning.
Good morning, Steve. Thank you for having me.
I'm so glad you're here. I was just having this conversation with some friends who were talking about cravings and really what is behind some of these cravings. So before we talk about specific, perhaps taste groups, salt, sweets, that type of thing, in general, where do cravings come from? What is it that might contribute to them?
You know, it's an excellent question and a very important one. The first thing that cravings are is your body talking to you and saying, pay attention. And you need to pay attention because cravings can be a result of blood sugar swings, certainly the most common, but also sleep deprivation because you have hormones that are secreted that either increase satiety or decrease it. And so you want to make sure that you're getting proper night's sleep. High stress, cortisol release is going to cause problems with lower sugar or higher sugars, insulin resistance, and so that will cause cravings. Emotional regulation. You know, are you stressed out? Are you trying to feed yourself something that you're not getting? And so we want to be paying attention to that. And then every now and then there are problems with nutrition gaps where you actually have deficiencies in things like iron or B12. So you want to be paying attention to this stuff because it's your body talking to you saying, I need something. And then you need to pause and go, well, what is it you need? And that's the best way to address these things. And you're right, you're talking about certain tastes and whatnot. I can give you a little bit more clues as to what's going on.
Yeah, I want to get into that. And first of all, I completely agree because I admittedly, the sleep deprivation, when we work these early morning, middle of the night hours, sometimes we find ourselves eating to stay awake, admittedly. And I promise you, we'll work on that. Let's talk about a couple of the foods, first of all. People that crave very sweet things, what particularly might we be missing that would lead us to crave something sweet?
So blood sugar drops, obviously, is the big thing. And the last thing you want to be doing is eating something sweet when that happens. So what you want to be doing is taking some protein, maybe some Greek yogurt or some nuts as a way to increase your blood sugar in a more stable manner. But you also want to make sure that you're not skipping meals. You want to make sure that you've got maybe a small walk can also help stabilize your blood sugar. But eating healthy fats and eating healthy proteins is a much better way than taking a quick hit of a carb.
I like the idea. Take a quick walk, just kind of see if you still have that craving a few minutes later. All right, I want to get to a couple real quick if we can. We'll go lightning round here. If we're craving something sour or salty, what might that mean?
So sour is very interesting because sour actually may mean that your stomach needs a bit more acid, especially if you've been pumping Tums because you're constantly under stress and you get a lot of stomach acid. So sour tends to be your body needs something to help you digest your food. That's why we need stomach acid. So fermented foods like sauerkraut can help, or yogurt is a healthier way to respond. But but sour is my stomach needs help digesting. As far as things like craving salt may be an issue of electrolytes. So salt may be maybe a pinch of water with a pinch of sea salt in it, or eating things like olives or nuts can also help address the electrolyte issue.
And the last thing for you, real quick, and people might have seen the strange addiction type shows on TV or otherwise. If something that would typically not be non-edible, can that really be an iron deficiency?
Yep. Pica, and so especially see it in kids eating ice chips but eating dirt. And so sometimes that gives you a signal that your body is actually deficient in things like iron or B vitamins, and you want to be paying attention to that as well.
Fantastic. Dr. Kaplan, thank you so very much. It's so fascinating to me. I appreciate your insight this morning. Thanks so much for joining us. And there's the information if you'd like to find out more about the Kaplan Center, or you just want to go to their website at kaplanclinic.com.
Sure, a lot of people just watch that and go, that's my issue.
Right? But it helps you. I mean, I crave too much sugar, but now I know what I can substitute it with. But the bottom line is, if you have those food cravings, a lot of times a drink of water or a short walk, they might go away.
Your body is trying to tell you something, so make sure